Thyroid disorders are noted more commonly in women with polycystic ovary syndrome. This can be either the presence of thyroid antibodies or borderline TSH values or subclinical hypothyroidism. The subclinical hypothyroidism is associated with a diminished sex hormone binding globulin, which results in an increased level of free testosterone. This can make some of the symptoms of PCOS worse. We know that thyroid disorders, both goiter and autoimmune disease, are found more frequently. A recent study suggested that goiter may be up to 2 times as prevalent in women with PCOS, while the presence of thyroid antibodies may be found 3 times more often in women with PCOS. While these can be seen hand in hand, doesn't mean that one condition causes the other, or that in any way there is a treatment of one is going to correct a disorder with the other. Now, women with PCOS and thyroid disorders seem to do less well in IVF and may have a slightly greater risk of early pregnancy loss. The greatest risk associated with subclinical hypothyroidism, however, would be brain development during the latter part of the pregnancy. So if a woman is detected to have a thyroid antibodies, we would generally recommend thyroid replacement, usually at a low dose, to make sure that the TSH is suppressed back into a normal range, or if the TSH is already normal, to make sure that there's sufficient thyroid support for the pregnancy. For a normal woman, TSH levels up to 4.5 are normal, but during a pregnancy or in a patient trying to conceive, we like to see the values at 2.5 or less. So in summary, let me say that I don't think at this point there's good evidence showing that one condition causes the other. There's a recent study that does suggest that treating PCOS women with metformin will reduce TSH levels and help normalize free T3 and free T4 levels. But I think in general the best approach is for all infertile women or women with PCOS to be screened both for a comprehensive evaluation of their polycystic ovary syndrome and for thyroid disorders. And at present the best bet is to treat them both independently.